Joann Wrenn. I'm the administrator at Madison Health and Rehab, and I've got a little bit of stuff here. I get distracted easily. I am doing my capstone on leadership, and I will not read all the slides, or at least I'll try not to. I work for Madison Health and Rehab. It's in Morgan County. We are a Pine Leaf facility. Ms. Shayla Cook is our owner and operator, and we are very proud to work for her. And I really appreciate her letting me have the opportunity to do this. So the Georgia Leadership Certificate Program has been a year-long educational session where in January of 2015 we started as a group. We were challenged to become better leaders. Where would we be without an interdisciplinary team? In long-term care, residents are our priority. We need our housekeeping staff, our dietary workers, our social services, activities. Yay, Rita. Come on. Yay, Rita. Okay. We also need our CNAs, our nurses, maintenance, laundry, and of course, our administrative staff. The Georgia Leadership Program has required us to do certain readings, and one of ours was on the 5 dysfunctions of a team. And I would like to say this, that if you have not read these books, you need to try these books. Disney, If He Ran Your Hospital, was one. But the 5 dysfunctions of a team will teach you to broaden your horizons, show your tolerance and compassion, and empathy for your coworkers. Though I am the administrator of Madison Health and Rehab, I am an employee of my facility along with my coworkers. In this book, The 5 Dysfunctions of a Team, Mr. Patrick Leononi, I cannot say his name, so I will refer to him as Mr. Patrick, starts with a pyramid, and that's kind of messed up, but the absence of trust is our first one. He explains in his book that we must be able to trust one another. In order to do so as a leader, you must show that they are vulnerable and that they are human, and that there is no recourse or punishment for a team member asking for help. Fear of conflict is our second step. Upon being appointed to the administrator's position at Madison Health and Rehab, I was attempting to learn my new job and the guidelines. And I made a suggestion, which in turn was a disaster. The department heads were very fast to remind me that this was my idea. Overall, because of my suggestion, the team did as I suggested, which they knew would not work, but because I was the administrator, they went along with me. Fear of conflict. You remember the story about the emperor and the new clothes? You must say when something is not a good idea. Someone may not choose to listen to you, but you can still say it. The third step was the lack of commitment. Most people want to be heard and express their ideas. Even if their idea was not accepted, they feel a sense of accomplishment and a commitment to the project. Accountability. When people have not committed, they do not hold each other accountable. Sometimes peer pressure is the most accountability that you can have. Most leaders will agree that accountability is the most difficult. Leaders who choose not to confront the problem, for example, they say, I'm too busy to become involved with the drama, I do not want to deal with this, or sitting back and waiting for the member to hang themselves, can lead to determination. Consequences of your actions is accountability. Inattention to results. Results matter, but they must be made very clear. For example, quantitative results are easier to deal with. Staying within your budget, there are consequences such as loss of bonus, temporary suspension, cutbacks in management. In long-term care, state survey. So overall, the book of the 5 dysfunctions of a team identifies that if you focus on the results, you will have accountability, which in turn leads to commitment, where conflict was involved, which came from trusting your team leaders, providing the best outcome for the residents in your facility. And if your actions inspire others to dream more, learn more, and do more, and become more, you are a leader, by John Quincy Adams. I have one last thing to show you. My presentation this year, and I looked really hard before I got in here. My nursing staff gave me this for Christmas. It says, I survived. On the back of it, it says, I survived 3 state surveys in 2015. So anyway, that's why I ramble a little bit more than I have. Thank you very much.